Good morning. So many of you are young patients, parents of young patients, providers of young patients, dealing with milestones and lots of critical pediatric life junctures. So why should you be interested in a talk about adult patients? For a few reasons. Actually, until now, ABC hasn't had the bandwidth to really build out a program of support for us adults. And it's a little strange for me at my age. I was born with classic bladder exstrophy in 1963. I'm 61. Those 6-year-olds are going to grow up to be 61-year-olds, just warning you. But I had never heard of ABC. And I think like so many of us, lots of us go into healthcare, but many of us concentrate on something that is maybe not our exstrophy. So it's super rewarding at this point in my life to be working on this project. So thanks, Pam, for letting me kind of crash ABC a couple of years ago, saying, I think we need to do something. And I do have a bit of a background in patient engagement. So to create a program that's relevant for our BE patients into the future, we really need your help too. So I just encourage you to listen and come back and come up and find me this weekend and see if there's some ways that we can engage. I'm not sure why I can't. I'm pressing the green button a lot. Is there we go. Oh my gosh, it shouldn't be that hard. Okay, so first, here's our overview. I'm going to talk about the purpose of our Adult Patient Advisory Council, the process that we've gone through to create it, and the key achievements and work that we're doing, what our future plans are, and then I want to invite you all to engage with us. So I'm kind of a bit of one of the ringleaders of this little band, but I want to introduce the band. We've got 5 of us total here this week, and I'd love to have Alex and Faith stand up, and George and Krista. So I wanted you all to know who they are. So if you could, if you have ideas, you don't have to come to me. We meet monthly and talk about our priorities. And we're super bummed that Jerry's in the top center picture and Thomas in the lower left aren't able to be with us today. So what my first kind of coverage here is to talk about the purpose. And at first we got together and said, we just need to build some tools. We need the big gap in finding care. Let's build an adult provider directory. But we realized that, and we talked for a good year before we actually created the council, Thomas and I did, and we realized that there's lots of areas where we can have an impact. Tools and resources, engaging in research, creating community, and then helping to navigate care at all points of life. We all know that really critical juncture between pediatric to adult, when we have to leave the cocoon of the pediatric system and enter into finding our own way, choosing our own adventure. But what can we do to help not only that time, but also the time that we come off and on insurance, the time that we leave our parents' insurance, the time that we have to choose Medicare. There's lots of areas where I think that we can make a difference. Some of these, I've given some topics of some things that we've created under here, and I'll talk a little bit more about a few of them. So timeline of our achievements, we established the council in the spring of 24, so only a year ago. We've hosted 3 virtual patient focus groups from adults. And what we're doing is gathering their insights to help steer the ideas and tools that we want to create. We created a patient landing page on the ABC webpage, on the ABC website. And this landing page is for our adult group, but it also points to a lot of other resources. We have already developed an adult provider directory. This is really big. It is not fully covered. We don't fully cover the US yet. We would love for it to cover US and Canada and Mexico. But we, at this time, we have enlisted the help of a number of doctors who have agreed to be on this list, and we want your help to build it. We have also revised frequently asked questions, And we delivered yesterday a pre-conference workshop, which was super great. There were about 20 of us that got together and really understood the value of that sense of community and connection and purpose. So the landing page. It's pretty sparse right now with some ideas of what things are coming, but even the adult provider directory, which we will be publishing really soon, will be updated here. So there'll be a link in this page. Here's the provider directory. As you can see, not every state is listed. And actually, I already know there's some on here. We just haven't updated them yet, but there's some big gaps. New York is not on here. Most of New England is not on here. And we know the Southeast is another area. But if you click into one of the states, what you'll see is a list. There's some formatting issues right now, which is why it isn't published yet. You'll see it's kind of very light on the bullets. The font is too light, and we need some accessibility work on the website. But this will give you an idea for each provider, what area of expertise they cover and the conditions treating. Our future plans is to continue to improve the website with resources for adults. We want to actually create webinars that are hosted by providers, by doctors, by urologists who have expertise in certain areas. Maybe these are very specific for particular conditions, fertility, sexual function, what are our health changes as we age. We're really excited about developing a more formalized peer connect program. So an adult who maybe has been struggling with some things at a point in their life could reach out and speak to somebody who has maybe at a similar life stage, similar experiences. And we want to continue to grow the relationship across our entire BE community to highlight and identify the needs that we need to fix. And of course, get that adult provider directory published and conduct and promote patient research, which leads me to kind of probably one of the most important slides I'm going to show here about the new research survey, the research study that we're launching very soon called the BEEC Patient Lifespan Study. I can't stress enough how much I'm hoping that each of you will take this survey. It is this initial patient research collaboration is with Dr. Hadley Wood and Dr. Annalise Ionson, who developed this study and worked with us on the survey questions over the last 2 years to ensure that the questions were relevant and made sense and had and that really kind of made sense in the lifespan of the patient. So they interviewed parents of toddlers, interviewed pediatric patients themselves, teens, adults, before submitting for IRB approval. So we're excited to collaborate on this study. And what it's going to do is assess our surgical histories, how we utilize healthcare, what are our healthcare seeking behaviors, bladder management, pain, how do we, and put those things together. We want to, for the first time, we're going to be establishing a BE patient database, sort of this baseline that ties the medical and surgical history to kind of our patient-reported outcomes and patient experience. So this study really resonates with me, and I can't encourage enough. If there are folks in the room that have, for example, are part of patient support groups and wouldn't mind being ambassadors for us with the survey, we're going to have little badges, QR codes that you can distribute to your friends and other patients. The concept of this is ultimately to create, like I said, this baseline of where patient report outcomes are today, but also to do longitudinal studies and to set us up for more research and better outcomes in the future. So I'm going to wrap things up. And while I do that, if you don't mind, Alex and Faith, to bring up something that we did yesterday. We got together yesterday and had a great session where we ideated on a number of areas that we wish could be made better for adults, and we created what's called the wish tree, which will be sitting up here and you can come look at it during breaks as well. So I want to encourage you, if you weren't an adult who weren't able to attend yesterday, come find us or come look at the wish tree. And what we'll do is, yeah, probably set it up right over here, Alex, against the railing there. Yes, so people can come see it. And find us to talk about things that you would like to see more in the future. Here are some areas of ways that you can engage with us. Share and promote Dr. Wood's lifespan survey and study. Help us expand the adult provider directory. This is, and also help us improve the diversity and representation on our council, as well as language for the tools that ABC offers. So if that's an area of expertise you have, or background and culture, I would love to talk with you. Invite us to meet by Zoom with your healthcare team or your patient support group. Volunteer on a project. I mentioned a number of those. So we'd be thrilled to have you engage with us more and share your insight and questions with us. So thanks so much. I appreciate the time today, and I really don't forget those kids are going to grow up faster than you think, and we want to welcome into the adult side. Thanks.